All right, then. So, World Oral Health Day is our focus. And of course, we're looking at this. We're trying to unpack the science behind tooth decay and good oral health hygiene. So, let's bring my guests to the studios. Joining me right now, Dr. Oluwole Olusanya. He's the chairman, Nigerian Dental Association, Lagos State Chapter. Dr. Olusanya, nice to have you in the building. Good morning.
Good morning, Victor.
And how are you doing?
Fine, thank you. Fine,
all right.
Thank you.
So, you are a consultant?
No.
Oh, not yet. Okay, very, very soon, right?
No, we're not in that line.
Oh, you're not in that line?
Chief Dental Officer in Lagos State.
Okay, so you're quite different from the consultant.
Yes.
All right. Joining him as well, I have Dr. John Wemambu, who is a Secretary, Nigerian Dental Association, Lagos State Chapter as well. John Wemambu, how are you doing?
Very well. Good morning, Victor.
And you're welcome.
Happy to hear.
You've been here before, right?
Yeah, I've been here twice before.
Twice, all right. So what do you make of the transformation? I look to your left there, you see the big screens showing the roads.
Yeah, you know, when you were going on with the announcement, I was just looking at it and really enjoying the fact that I could see life. It's real time what we're talking about.
All right.
Yeah, it's nice. It's good. It's a good... Innovation from the last time I was here.
All right. And Dr. Olusanya, what do you make of that?
Yeah, very nice. We're seeing it just as you are seeing it, and just as everybody will be hearing it from you live. It's very good innovation.
Okay. So let's jump into the conversation this morning. World Oral Health Day. I need you to just talk to us. What is the essence of that day, and why is it important to raise awareness about it? Dr. Olusanya, let's start with you.
Okay. World Oral Health Day was conceptualized by the International Dental Federation in about 2013. It's a day set aside to celebrate the dental profession, dentistry.
Okay.
We're celebrating the practitioners, the professionals that work within that space. Okay. Dental surgeons, dental nurses, dental therapists, dental technicians, dental technologists, everybody within the dental industry, including even those that manufacture dental products. Now, of course, when you want to celebrate, the best way you celebrate is by giving back.
Okay.
So, yearly, all these people I've mentioned will come together on one day, this day, 20th of March, to find various ways to give back to society.
Right.
Of course, the best way to do that is by having dental programs which either enlighten, inform, teach, and of course, since we are in the health sector, treat the public.
All right. So, Wemambu John, if you're to look at it from that perspective, because he's saying this is a day for you guys. You guys are the practitioners, you're the professionals in this industry. But a lot of times we seem to misconstrue that, and all we're thinking about is our oral health. So, how do we, negotiate that and put all of that into one basket?
Okay. So, I would start by looking at the theme for this year, and that's a happy mouth, a happy body. Or healthy mouth, healthy body. So, just like he said, aside celebrating all dental professionals in that field, we also look at the health implications of not taking care of our oral health. And this year in particular, we're looking at the interconnection between our oral health and our mental health. So, in general, each time when people just look at it as, okay, like you said, toothache, it's the oral health goes much more than just toothache.
Right. Yeah.
So like this year's team just lets us know that from our oral health, there's an interconnectivity with the mental health. So it is not just that toothache, because that toothache, that tooth problem, that oral health problem could even lead to some mental health problems. All
right. We'll touch down on that even as the program moves on. But how is the state of the dentistry or the dental, those that are dentists now, how is the state of the profession in Nigeria, Dr. Olusanya? How are you guys coping?
Oh, we're coping just like every other sector. Both the public and the private sector has gone quite far in enlightening the public in what we do. The truth is that pain is the bane of dentistry, and once people come down with dental pain, they know where to go. They come to the dental clinic. Of course, we have issues with many other people trying to be quacks, so to speak, trying to break into the health sector and take over our positions. But generally speaking, I think Nigeria has come a long way.
Right.
Yeah.
So in terms of personnel now and the workforce, do we have enough dentists in Nigeria?
Well, no, we don't have enough dentists.
What's the population right now?
The population of dentists practicing in Nigeria will be less than about 4,000. We have about 5,000 registered dentists, but you find out that quite a number have, well, Jackpa.
As the case may be.
As the case may be.
Okay.
They have gone and they are still going. In fact, what you find out is most of the young ones coming out these days, there's a lot of disenchantment with what is going on. So you find that population, the young doctors coming out now, the young dentists, they are going in their numbers.
Wow! So the workforce is being depleted.
It's been depleted.
Quite unfortunate. 4,000 to a population of over 200
less
million.
Than 4,000. I don't even think they will be up to maybe 3,000, 3,005 in the country. Yeah.
All right.
Thereabout.
And I'm just curious, is there a specification? Is there anything from the World Health Organization that says one dentist to a population of like 1,000? Or what do you have?
Yes, actually, the World Health Organization proposes a situation of one dentist to about 2,000.
One dentist to 2,000?
Yes, one dentist to about 2,000 to 5,000 people.
Okay.
But what we have in Nigeria alone and worldwide is a far cry from that. Now, in the sub-Saharan Africa and the developing countries, Lagos, for example, out of the 3,000 dentists you have in Nigeria, majority, about 60% of them are concentrated
in Lagos,
the southwest.
Oh,
Lagos takes about maybe 40 to 45% of them. Then you have them just scattered all around the country.
Wow.
So which means those in the far north, those in the far south, far east and south have less than the population. But even us, those of us that are in Lagos right now, will be averaging, I think, one dentist to about 200,000 or 300,000,
which is a far cry
far cry from what it should be.
Okay, so we're having more dentists in this part of the world. Is it to say that people in other parts of the country, they really pay attention to their oral health? Is that the way it is?
No. I don't think exactly that is the way it is. Going back memory lane, just like you said, the dental profession has come a long way, but still a far way off from where it should be. Then those in some other regions of the country are picking up, but academically and educationally, it is sort of skewed towards the southern part of Nigeria.
Okay.
And then even in the southern part of Nigeria, the southwest seems to concentrate more.
Right.
So that's where you have many of these professionals coming from.
This
but
part.
Yeah, you have it getting better in other regions, but it's still a far cry from it.
Just to add to that,
yes.
You find out that healthcare personnel in general are more in the developed urban areas. People don't want to go to the rural areas. If you look up north, there is less development.
Right.
So you are going to find it hard for a dentist to want to go to some of those places where all the opportunities he wants to have a good life are present.
Okay, but I mean, even apart from that too, one might also argue that the consciousness of people really taking good care of their oral health, is it really there from your assessment as dentists?
Okay, generally, even from the days of our forefathers, they use
chewing
sticks. And so which means they have one way or the other, they have that awareness about the dental health.
Okay.
Now the problem is when it comes to the modernization factor here. Yes, the awareness is there, but it's not a function of the wherewithal.
Okay.
To take care of your oral health. People know they have to take care of their oral health, just like Dr. Olusanya earlier mentioned. Once pain comes, I mean, I've had people wake me up 4 a.m., 3 a.m. with pain. So, but once pain comes, you would definitely seek solution. But now the problem is, are you socially, mentally, and financially capable to be able to seek solutions?
So let's begin to talk about today now and oral health. So, Dr. Olusanya, when we're talking about oral health, You said, or one of you said earlier on, that it's not just the teeth alone, right? So what are we referring to?
Okay, when we're referring to oral health, we are looking at the mouth and the structures around the mouth. Inside the mouth, we have the teeth, the gums, the supporting structures of the gums, which is the bone underneath the gum, which we call the periodontium. The gum, we call it the gingivae. We're talking about the tongue. We're going as far back as the early part of the throat. Then, of course, the palate, which is the upper part of the mouth. Then outside the mouth itself, we have the upper and lower jaw, which we call the maxilla and the mandible. And that encircles just below the eye.
Okay.
Then we can go a little bit way to the neck.
Right.
And I think most of those parts qualify what is the oral structures involved when we are talking dentistry.
So the tongue plays a pivotal role, right? Can a human being survive without a tongue?
Dr. Wemambu.
well, I'll put it this way: it's near impossible, because if you look at the tongue, it plays major functions, from helping you to swallow. If you can just imagine how it goes when you put food in the mouth, it is actually the tongue that pushes it back to get in there.
Right.
And so and then that aside that, this for you to be able to speak and speak fluently,
right,
your mouth needs to be constantly lubricated. If you've had cases of people who have a wound, also maybe you bite your tongue. If you've ever bitten your tongue when you are eating, the pain that comes, you will understand the role the tongue plays, because that pain that follows that you can't even eat, you can't chew, even speech becomes problematic.
Wow.
You know that every structure, just like Dr. Olusanya said, in fact, we give it a general term. We say craniofacial.
Wow.
Yeah, maxillofacial. That is the whole face from the cranium down to the neck region.
Okay, so the tongue plays very pivotal role there.
Very.
Let's talk about, diseases that can affect the mouth. What are the diseases?
Okay, the common ones that we want to talk about would be, the normal dental caries, which cavitation holes in the teeth, and of course you have the periodontal issues, which comes with maybe your teeth is shaking, and then you have if we go further than that, you have halitosis.
Okay.
The people complaining of very bad breaths when they speak. So all these factor in. Then we also generally broadly divide the diseases that affect the mouth into what we call benign diseases and malignant or cancerous diseases. So all this.
So cancer can affect the mouth as well?
Wow.
Yes.
We have lots of cancer that can affect the mouth.
Wow.
Every cancer that affects any part of the body affects the mouth.
Right. So
yeah.
That's good. So let's talk about the causes now. What are the things that will cause our teeth to go bad?
Okay, before I go into that, I just want to add that one of the common things that we see a lot, and it has reduced in Lagos actually because of certain laws passed,
right,
are accident victims, and they come up with fractures of the teeth, fractures of the jaws,
right,
thereabout. So it's a very common thing, but we have reduced that of late because of our traffic laws with regards to Okada and wrong driving and things like that. I want to believe Traffic FM is helping us with that,
right,
trying to assist transport. What are the
causes?
Okay, so causes, if you look at bacterial decay and holes in teeth, the substrate usually is sugar.
All right. Do I have a call, Mike? Let's see if we can pick that right away.
The substrate usually is sugar.
Okay, sugar
works on food that remains on our teeth.
Okay, let's take this call. Hello there.
Hello, good morning, sir.
Good morning. Please turn down the volume of your radio.
Okay, I've turned it down.
Okay.
My name is Oluwole.
Oluwole, how are you doing?
We thank God.
Okay.
Now, what I want to find out about is that, for someone to be having sore, maybe on the tongue, in the mouth.
Yes.
Yes, but what would be the concern when, how could it be visited?
Okay, all right. Very good question. Thank you so much. Just listen. My guest will give you a response. All right. So for someone to have sores in the mouth,
Okay, so basically, when you have sores in the mouth, we have to look at several factors here. A major cause of sores, what we call oral ulcers, is stress. Stress can cause oral ulcers. You could also just have what we call iatrogenic. You just maybe bite on your tongue. But those sores in the tongue can also be an indication of a major health condition. Things like diabetes, things like the tumors I was telling you about, the cancers, they manifest as sores too. So there are a whole lot of systemic conditions that could manifest as sores in the mouth. Okay. So how, I know the caller was asking how to go about it.
Yes.
The first and basic thing to do is to see a dental practitioner, because that sore in the mouth could be an indication. It could just be the first sign of a major condition that is going to happen to the body.
Right.
So when you see a dental practitioner, he looks at it and he'll be able to tell you, okay, this is stress related, and he recommends adequate measures to take care of it. But he looks at it and he feels, oh, this is more. Then we do what we call take a biopsy of it and send, and we're able to tell you, oh, this is something sinister, this is something we should be worried about.
All right.
So sores in the mouth.
All right,
you need to see a dentist.
Let's go back to the president and the chairman. So you were talking about the causes?
So yes, so for caries, what we call the holes in our teeth, you are looking at bacterial decay of teeth. The bacteria, which are of course present in our mouth naturally, they are the ones that are beneficial, the ones that are just opportunistic, and then the ones that cause harm. But generally they feed in our mouth since they live there, and they produce acid which actually begins to demineralize our tooth surface.
Right.
The demineralization process leads to holes, and the continuous demineralization of the tooth will lead to a carious cavity which we will need to treat.
Okay.
Then you have the case of our gums that could be infected. They're infected because of poor oral hygiene. We eat food particles, saliva settle around the tooth, around the gums, infect the gums, and then the gums start bleeding. They get softer, and then over time the tooth begins to shake from the roots in its as it sits in the gums.
All right.
And so we have gingivitis and periodontitis like that. Then, as he said, when we come to the cancers, you will find out that there are things that predispose one to oral cancers and tumors more. Some of them are, for example, poor oral hygiene to start with. Some of them are things like the kind of diet we eat. Some of them are smoking, alcohol.
Okay.
Yes, those are things that are the environmental factors.
All right. Okay. So because of time now, and I need you to have very, very brief responses so that we can cover a bit of distance as relates to this. So, pain, or perhaps the signs and the symptoms that will show my teeth are bad. What are they? What are the signs?
Like you mentioned it, Victor. You said pain. Okay. First, pain comes. Then for some people, you have what we call halitosis, that's bad breath. For some, you have holes on the teeth, even with or without the pain. Then for some, you have the tooth just suddenly starts shaking and maybe suddenly starts falling off. These are signs that there is definitely problem with these teeth.
So as one ages, does age affect the state of the teeth?
Naturally, if you maintain and keep a good and standard oral hygiene from start, age should not have that marked effect on the teeth.
You mean it?
Yes.
Even when you're 70, when people get old, they begin to speak something. When they talk, you begin to notice.
If you have maintained good oral hygiene, even as you age, there shouldn't be any problem.
You shouldn't have any problem.
The problem is that having lived so long with so many insults to the oral cavity, there's a possibility the longer you live, the longer there is time for 1, 2, or 3 things to have gone wrong.
Wow.
Another thing you will find is discoloration of the teeth.
Let's take this call. Hello there, good morning. Hello.
Good morning. My name is Andrew. I
And
just encountered the program briefly.
Okay.
Just when you were saying, can one survive without a tongue?
yes.
I was just laughing. One can survive with it. The survival is death. One can survive with it. Two, a quick one. This one you are asking now. My father-in-law died at the age of 93. That was 2019.
Okay.
None of his tooth has toothache. That is one. Two, he didn't go to a dentist. I asked him because I had toothache from 14 years. And I've removed two teeth from the age of 14.
Wow.
And I've done permanent teeth in my teeth. Now, he said there is this Paco. You talk about using this Paco to
Chewing
wash
stick.
mouth, all this.
Right.
Yeah, chewing stick. Not just ordinary chewing stick. Because one of the presenters there will understand what I mean. And so on. He said he has been using it. He uses toothpaste. After using the toothbrush to wash from childhood, he'll be using that as another supplement.
Okay.
And at night too, the same thing. He said that was what made him.
Okay.
No toothache, no holes in the teeth, no teeth problem, no dentist, nothing. So people can survive even without that. Brush 2 times a day. Maintenance of the teeth is a good one they are talking about.
All right.
And two, what I observed, I want to clarify that. What smells in the mouth? Is it the tongue that makes the mouth to smell or the gum?
Okay then. Thank
That's
you.
what I've been asking different dentists. They've not given me the answer.
All right. Thank you so
Thank
much.
you.
All right. Quickly, can you just answer that question right away? What smells? Is it the tongue or the teeth?
Well, it could be all.
It could be both.
It could be both. Generally, the major thing, there are different types of factors that cause halitosis, which is bad breath. But generally speaking, if there's any infection in the mouth, whether it's of the gums, whether it's of the tongue, whether it's of the around the cheeks, anywhere, you will have bad breath.
Okay.
We also have bad breath from our lungs. We have what
that
we
could also
call
come in as
upper
well.
and lower respiratory infections
All right.
that affect them.
Okay then. All right.
Okay,
080-99120777. This one says, "Hi Victor, and good morning to your guests. There's a rising trend in teeth whitening treatment. Are they safe and do they have long-term effects?" This is coming from Ngozi. Ngozi, thank you so much. Hello there. Hello. Yeah. Good morning.
Hello, good morning. So reporting live from Hotel Dollar Secretary.
All right.
Yes. So, just a quick one. Due to the traffic backlog that
Oof. All right, Sadiq Yusuf, you might have to call us back. Let's see if we can get that report. He's a live motorbike reporter at the scene of the accident in Otedola, where we had that broken down articulated vehicle. All right, so teeth whitening, Ngozi is asking, are there long-term effects?
Okay, before I'll leave Dr. Olusanya to answer that, I just quickly want to add something to the previous caller that said his 92-year-old father-in-law. In addition to all those the father-in-law has done, genetics plays a very important role.
Oh, so
in that.
your family history.
So the family history, the genetics might be a very, very positive and strong factor in
As
that.
well.
Yes.
Okay, then.
So I'll
Right.
leave Dr. Olusanya to answer that.
Just a second. Yes, go ahead, Sadiq.
Okay. Yeah, just to inform you that concerning the impediment at Otedola here, that the backlog that was caused by this impediment has finally subsided, and one of the container is almost off the road, and the second one is standing up, very well positioned on the service lane. So motorists are enjoying like 3 lanes from this artery down to Secretariat.
All right.
So that is the.
Thank you. Thank you so much, Sadiq Yusuf. He's a live motorbike reporter. So recovery of that accident is almost completed, so to say. All right. Teeth whitening in 30 seconds.
Yes, tooth whitening. Okay, well, we caution patients, members of the public, on tooth whitening unregulated. That is going to quacks, going to people who are not trained in teeth whitening. Most of the
Beauty spas.
beauty spas, there are many people self teeth whitening. They go under the bridge, they go to so many places. Now salons all over the places are whitening teeth.
Right.
If it is done by a qualified professional, the dentist.
Okay, so that's the idea. They must go to a qualified professional.
Yes, because
All right,
there's an amount of tooth layer that you can erode off.
Okay.
And that the tooth will not be affected.
And only the professionals will know about that.
Yes.
This one says, Dr. Olusanya, please, can drinking more water help prevent tooth decay and gum disease? Shola is sending that one in. Shola, thank you so much.
Generally speaking, drinking water is very healthy, not just for preventing tooth decay.
Okay.
One of the best times to drink your water is usually after meals, particularly if you take a sweet meal. It will help to keep the sweet substrates that will stay on the teeth and cause holes and all that away.
There are lots of questions that are popping in here for you. Shehu Ibrahim is talking about costs. It says, what can be done to make oral health much more affordable? But as we round off the program this morning, what's the message from the Nigerian Dental Association, and how are you guys going to be marking this day?
Okay, so today's theme is a happy mouth is a happy mind. So, what makes the mouth happy? When you're able to smile, that means your teeth look presentable. When you are eating well, no pain there about from your teeth, so the mouth is happy, and that reflects in the mind. You're able to think well.
All right.
The proximity of the mouth to the brain is so close that if you have pain in your mind, you are not going to be in a good mental state to carry out.
And so, how are you guys going to be celebrating it today?
We are going to be giving back to society all over Lagos. There are outreach programs, boot camps, orientation programs where we are going to screen patients, give them vital oral health, oral hygiene information, and treat those we can. Okay. Discounted prices at most of the hospitals across Lagos.
Which is very good. So if anybody have any oral health issue, Dr. Wemambu, John, where can they go to?
Yeah, you could go to any of the general hospitals in Lagos States. My own Igondo General Hospital, we're giving 50% discount for a week on most dental procedures that you come in there for. And so they are free to go. And they can also visit the private clinics. And a quick one, the person asking about cost. Well, the HMO, the health insurances have come in. You have Lagos State Health Insurance too that has come in. And then, like I always advise people, registration is a one-off. Once you register, get the small money, register in any dental clinic, and you can go there for consultation free at any time. Only when you take an active procedure do you pay. We'll
leave it at that for now. It's nice having both of you in the studios. Thank you so much for being here.
Thank you very much.
All right, I've been speaking with Dr. Oluwole Olusanya, who's the chairman of the Nigerian Dental Association, Lagos State chapter, and he's been supported this morning by Dr. John Wemambu, who's the secretary of the association. We have to go. Please take good care of your teeth, and of course ensure you visit a dentist so that you can have the best of examination. Mike James has produced the program this morning. Faith Ojoko in the building as well. Maximum shout out going out to Remi Aluko and Okpayemi Shodunke, both of them of our social media unit. Our executive producer is Tayo Akonle. My name is VIctor Oteri. Have a great day. Bye.